Most people believe you can only find out if you have diabetes through a blood test. You go to the doctor, the lab work comes back, and that's when you know. I understand why people think that. For years, that's what most of my patients told me too. My name is Dr. Olivia, and I've been practicing medicine for over 8 years. And what I've learned, what I see confirmed in my office every single week, is that your body starts warning you about high blood sugar long before any lab result ever would. And the very first place your body speaks up? Your feet. The reason I'm making this video is because of how many patients I've seen walk into my office, or worse, into an emergency room, who had every warning sign for months or even years and never knew what they were looking at. Today I'm going to change that for you. Just last month, I sat down with a patient. A 67-year-old man, retired, healthy lifestyle, felt fine. He came in for a routine checkup. But before we did any blood work, I asked him about his feet. He told me, "My feet have been a little numb for a while." I figured it was just age. He had 4 of the 9 signs I'm about to show you. His fasting blood sugar came back at 214. He was diabetic and had been for over 2 years without knowing it. The American Diabetes Association estimates that 1 in 5 Americans with diabetes don't even know they have it. That's over 8 million people walking around right now with a silent condition quietly damaging their nerves, kidneys, vision, and yes, their feet. The good news? A $12 blood test can catch this early. But first, you need to know what to look for. Let's get into it. 1. Tingling and numbness. Almost every patient has experienced this, and almost everyone explains it away. My foot just fell asleep. I was sitting with my legs crossed. Occasional numbness happens to everyone. But frequent recurring tingling or numbness in the feet, what doctors call peripheral neuropathy, is one of the earliest signs that blood sugar has been elevated for some time. The extra sugar in your bloodstream attacks the protective outer layer of your nerves. Think of your nerves like electrical wires. Every wire has a plastic coating. That coating lets signals travel cleanly from your brain to your foot. When blood sugar stays high, it's like an acid slowly eating through that coating. The wire still works for a while, but the signals get fuzzy. That fuzziness is the tingling. Peripheral neuropathy affects nearly 50% of people with diabetes. My daily recommendation? A 20 to 30-minute walk every day. Not a jog, a walk. Movement keeps blood flowing to your feet and protects those nerve endings. 2. Burning sensation at night. This one doesn't hit during the day. It hits at night, when you're alone, trying to sleep, with nothing to distract you. Patients often blame being on their feet all day, or summer heat, or just fatigue. But when someone tells me their feet feel like they're on fire, especially at night when lying down, I take that very seriously. Burning in the soles of the feet, particularly at night, is a classic early sign of diabetic neuropathy. The nerves in your feet have been damaged by excess sugar, and now they're sending incorrect signals to your brain. Your brain receives a heat message even though nothing hot is touching your foot. Think of it like a fire alarm with a faulty sensor. The building isn't on fire, but the alarm goes off because the sensor is damaged. Research in diabetes care found that burning foot pain is one of the first reported symptoms in patients later diagnosed with type 2 diabetes, often 1 to 3 years before formal diagnosis. 2 habits I recommend. Drink at least 8 glasses of water a day to help your kidneys flush excess glucose and add more fiber to every meal. Vegetables, legumes, oats. Fiber slows sugar absorption into your bloodstream. 3. Wounds that won't heal. This is the one that stops being uncomfortable and becomes genuinely dangerous. Patients say, "I had a little blister from my shoe 3 weeks ago, it still hasn't healed." They assumed it would close on its own. Most small wounds do, but not when blood sugar is elevated. When blood sugar is consistently high, your blood vessels narrow and stiffen. Oxygen, white blood cells, and nutrients that repair tissue cannot reach the wound fast enough. The wound sits there, open, vulnerable, slow to close. Imagine trying to water a garden, but your hose has a serious kink in it. The water is there, but it's not getting where it needs to go. The CDC reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States. Over 100,000 per year. Almost all started with a small wound that was ignored. Tonight after your shower, look at both feet carefully, between every toe, at your heels. If you see any cut, blister, or broken skin, clean it with mild soap and water, apply an antiseptic, and cover it. If it hasn't improved in 48 hours, call your doctor. 4. Skin discoloration. Around the ankles, patients see their feet turning darker or more reddish and say, "I think it's just sun damage." But there is a specific pattern of discoloration, particularly around the ankles, that I look for. When circulation is compromised by high blood sugar, the lower legs and feet don't receive enough fresh oxygenated blood. The skin changes color as a result, darkening deep red or even a bluish tint. Your blood is like a delivery truck carrying oxygen and nutrients. Your feet are at the end of the longest delivery route. When the roads narrow because of damaged blood vessels, deliveries stop arriving on time. A study in the Journal of the American Academy of Dermatology found that these skin changes are detectable, on average, 18 months before a formal diabetes diagnosis. The daily habit: 5 minutes of ankle circles, toe raises, and calf stretches every morning. That small amount of movement gets blood flowing into your feet. 5. Chronic, severe heel. Cracking. My heels crack every winter. It's just dry skin. That's common. But when your heels are cracking badly in the middle of summer, or no moisturizer seems to help, that's different. Diabetes affects the autonomic nerves, the ones that control automatic functions like moisture and sweat in your skin. When these nerves are damaged, sweat glands in your feet stop working properly. Your feet lose natural moisture from the inside out. No amount of lotion fixes the root cause. The American Podiatric Medical Association identifies chronic, hard-to-treat heel cracking as a significant indicator of autonomic neuropathy. Moisturize your feet every night, but never between your toes, as trapped moisture breeds fungal infection. And drink those 8 glasses of water daily. 6. Persistent swelling, edema. Occasional swelling from sitting or standing is normal. But if your feet and ankles are consistently swollen and you're leaving deep sock marks every evening, that changes the picture. High blood sugar affects your kidneys. Your kidneys control your body's fluid balance. When kidney function is impaired by years of elevated glucose, fluid accumulates in the lowest part of your body, your feet and ankles. The National Kidney Foundation reports that diabetic kidney disease affects 1 in 3 adults with diabetes, and lower extremity edema is frequently the first visible sign. When you rest, elevate your feet above the level of your heart, even a few inches on a pillow. Reduce sodium in your diet. Salt causes your body to retain water. If the swelling is new, persistent, or getting worse, bring it to your doctor's attention. 7. Sharp, electric shock pain. I see this most often in men. They say, "I've been taking ibuprofen for months. I figured it was arthritis." But sometimes the pain has a different origin, one that ibuprofen will never touch. When nerves are damaged by chronic high blood sugar, they can become hyperactive. Instead of going numb, they fire random intense signals: stabbing, electric shock, or a hot needle through the foot. This happens most often at night. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects about 25% of people with diabetes and is frequently mistaken for arthritis. Every morning, do 5 minutes of gentle foot and ankle stretching before you get out of bed. Flex your feet, circle your ankles, pull your toes back gently. Get blood moving before you put weight on your feet. 8. Persistently. Cold feet patients say, "I've always had cold feet, doc. My wife steals the electric blanket." I laugh with them. Then I ask, "Are your feet cold in July? Cold under 3 blankets?" That's when I become concerned. Cold feet that persist regardless of the temperature around you are a strong indicator of significantly compromised circulation. Your blood vessels have narrowed to the point where warm blood simply is not reaching your feet. The American Heart Association identifies peripheral artery disease caused by narrowed blood vessels as affecting over 8 million Americans, with diabetes being the single largest risk factor. The best response? A 30-minute brisk walk every day. Not a stroll, a purposeful, arm-swinging walk. Start with 10 minutes if 30 feels like too much. The important thing is to start today. 9. Hair loss on lower legs and feet. This is the one almost nobody talks about, the one most people walk right past. During a foot exam, I look at the lower legs and tops of the feet. Sometimes there is a visible absence of hair. The patient looks down and says, "Huh, I never noticed that." Hair follicles need a steady supply of blood and oxygen. When circulation is significantly impaired by long-standing high blood sugar, the follicles slowly stop producing hair. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients. Right after this video, look at your lower legs and the tops of your feet. If the hair is significantly thinner than the rest of your leg or absent entirely, schedule a blood glucose test this week. Approximately $12 at any certified lab. We've covered a lot today. 9 signs, 9 chances to catch something before it catches you. One of the hardest parts of my job is sitting across from a patient who has had every one of these signs for 2 years and is only now finding out why. Not because they didn't care, they cared deeply. They just didn't have the information. You now have that information. Tonight before bed, take 30 seconds to look at your feet. Look at the skin. Look between the toes. Feel for numbness. Check for any wound that shouldn't be there. And if you see or feel anything on this list, call your doctor tomorrow. Not next week. Tomorrow. You worked hard for the life you have. Don't let something as manageable as blood sugar take any of that from you, just because nobody told you what to look for. Now you know. If you found this useful, share this video with someone you care about. Subscribe for more conversations like this. I'm Dr. Michael Kent. Stay aware, stay proactive, and take care of those feet. I'll see you next week.